A deadly disease scientists are just now starting to understand. Good evening, everyone. I'm John Kessler, and thank you for choosing WENY News at 11. In the next 6 months, the World Health Organization says 20,000 people could eventually be infected by the Ebola virus. And half of those already infected have died. WENY's Asha McKenzie joins us live in the studio with what it means to us here in the Twin Tiers. Asha?
John, it's the deadliest Ebola outbreak in history, but the CDC and local health officials say Americans have nothing to fear because the risk here is low.
More than 1,500 lives and counting. 5 countries in West Africa have been exposed to the Ebola virus, totaling more than 3,000 cases. But officials at the Chemung County Health Department reassures the risk of infection in the United States is extremely low.
It's not airborne, so you really have to touch somebody who's infected in order to get the virus yourself.
Local health officials say they will continue to monitor the Centers for Disease Control's reports on the Ebola virus. And so far, there have been no cases in the U.S., and the CDC has set travel advisories for those traveling to Guinea, Liberia, Sierra Leone, Nigeria, and Senegal that have seen an outbreak.
The United States as well has precautions in place for those who may be exhibiting symptoms.
In response to the virus that could eventually infect 20,000 people, according to the World Health Organization, U.S. and British researchers will begin human testing of an experimental vaccine at the National Institute of Health in Maryland.
We're going to start the study on the vaccine here. What we're talking about is a vaccine to give to an uninfected person to help prevent them from getting infected. The same way when you and I were children, we got measles vaccines and mumps, and we got all those vaccines to protect us from getting infected.
And a recent Ebola vaccine called ZMapp was successful in treating monkeys who had the virus. In the studio, Asha McKenzie, WENY News.